Polycystic ovary syndrome is a hormonal disorder that affects millions of women worldwide. While PCOS is often associated with irregular periods, ovarian cysts, and hyperandrogenism, the research revealed the new factor for PCOS, chronic inflammation. Like irregular periods, ovarian cysts, and hyperandrogenism were not enough, now we also have to deal with chronic inflammation. Well, thank you, PCOS. Welcome to Holistic Ovaries. I am Agnese, and every week I post new video about PCOS so you can manage your symptoms better. And to support our PCOS community, please subscribe to the channel. In today's video, we are going to talk what is inflammation, what are the symptoms of inflammation in PCOS women, what is inflammatory type PCOS, and what to do to reduce inflammatory state. Several studies have associated polycystic ovary syndrome and low-grade chronic inflammation. Inflammation is when your body immune system tries to fight something that it thinks is harmful, like an injury or infection. But in women with PCOS, immune system is constantly activated, leading to chronic inflammation that can cause problems like insulin resistance, weight gain, and difficulty to get pregnant. It is like having overprotective bodyguard who won't stop fighting even when the harm is gone. But how to recognize that you are dealing with low-grade chronic inflammation? Joint pain and stiffness, digestive issues such as bloating, diarrhea, or constipation, acne, excessive hair growth, skin rashes or hives, dark patches on skin, weight gain or difficulty losing weight, fatigue or weakness, chronic headaches or migraines, difficulty concentrating or brain fog, insulin resistance and higher risk of type 2 diabetes, irregular periods or absence of periods, mood swings and depression, insomnia or other sleep disturbances, increased risk of heart diseases and hypertension, allergies, or sensitivities to certain foods or environmental triggers. Remember though, not all women with PCOS are going to have low-grade chronic inflammation, as PCOS have so many different underlying causes and symptoms. According to recent studies, around 40 to 50% of women with PCOS have low-grade chronic inflammation, and this is often called inflammatory type PCOS. It's important to reduce inflammation in this type of PCOS to help to reduce symptoms. So let's give the inflammation the boot and show who's the boss. Autoimmune protocol diet. Autoimmune protocol diet can be used in women with PCOS to reduce inflammation and potentially to improve symptoms. Autoimmune protocol diet is based on principles of paleo diet but is more restrictive, as it eliminates foods that are known to cause inflammation or to cause autoimmune response, such as grains, legumes, dairy, refined sugars, processed food, and nightshade vegetables. The autoimmune protocol diet emphasizes nutrition-dense food, including grass-fed meats, wild-caught seafood, non-starchy vegetables, fruits, healthy fats, and fermented foods. It also promotes lifestyle factors that can support healing, such as stress management, sleep hygiene, and physical activity. The diet is typically followed for 30 to 60 days, after which period some foods are gradually reintroduced to assess their effects on symptoms. However, if you are considering autoimmune protocol diet for your PCOS symptoms, please work with your nutritionist or your medical doctor, because autoimmune protocol diet involves restrictions and eliminations, which can be challenging for individuals with a history of eating disorders, which is so common in women with polycystic ovary syndrome. Target high androgen levels and fat cells. In addition to dietary and lifestyle changes, managing inflammation in PCOS can involve specific factors like dealing with high androgens and fat cells. Hyperandrogenism in PCOS can contribute to inflammation by activating mononuclear cells, leading to production of reactive oxygen species and pro-inflammatory cytokines. This process can also worsen insulin resistance, making it more important to deal with inflammation in PCOS. Adipose tissue, especially visceral adipose tissue, can be also the source of chronic inflammation in PCOS. Even normal weight PCOS patients can have a higher level of visceral adipose tissue, leading to low-grade chronic inflammation. By addressing those underlying issues, we can work towards reducing inflammation and improving overall health of patients with PCOS. Reduce omega-6 fatty acids. It is important to pay attention to type of fats that you are consuming. The modern Western diet often have higher ratio of omega-6 fatty acids compared to omega-3 fatty acids that can lead to inflammation, autoimmune disease, and other health issues. Both omega-3 and omega-6 compete for the same enzymes, and higher level of omega-6 can lead to shifting metabolism towards pro-inflammatory state. It's recommended to lower your consumption of omega-6 and increase your consumption of omega-3 fatty acids. However, it is important to maintain the ratio between omega-3 and omega-6 4 to 1 or even lower. Supplement with omega-3 fatty acids. Omega-3 fatty acids have anti-inflammatory properties and have shown to support cardiovascular health. So you can get your omega-3 fatty acids from the food sources like fatty fish, chia seeds, flax seeds, but if needed, you can also supplement with omega-3 fatty acids. Green cardamom. Another way to reduce inflammation in PCOS is to add green cardamom into your diet. The spice is rich in polyphenols and flavonoids, which have anti-inflammatory properties that shown the therapeutic effects in context of PCOS. In a study, women with PCOS and obesity took 3 grams of green cardamom powder daily for 4 months. Compared to placebo group, the women who took green cardamom reduced level of inflammation markers like interleukin 6, tumor necrosis, factor alpha, and C-reactive protein. This means that green cardamom may help reduce inflammation in women with PCOS. Herbal supplements. Several herbal supplements have been studied for their anti-inflammatory properties for women with PCOS, including cinnamon, curcumin found in turmeric, and resveratrol found in grapes and red wine. However, more research is needed to determine optimal dosage and efficacy on women with polycystic ovary syndrome. Additional supplements. Vitamin D, magnesium, and probiotics, and of course, berberine that can reduce inflammatory state of the uterus and ovaries in PCOS, but we are going to do separate video about that. These videos are always too short for me to share all the knowledge with you, and today I didn't even talk too much about stress reduction, exercise, improving your sleep, and improving your gut health, because I talk so much about this and I am sure you already know that they are your basic of managing your PCOS. If you would like, you can always add yourself to the email list where I share more content. And always remember to subscribe to the channel, comment, ask questions, share the knowledge with other women with PCOS, and I will see you in next video. Bye!